I am Dr. Rajeshwari, working as Associate Professor in the Department of Demography at Indian Institute of Health and Family Welfare, Hyderabad. Today I am going to discuss with you about sources of population data. The sources of data may be classified into two, primary data and secondary data. A common classification is based upon who collected the data. Primary data, data collected by the investigator himself or herself for a specific purpose. Therefore, information is collected directly through surveys, observation, interviews. For example, data collected by a student for his or her thesis or research project. Secondary data, data collected by someone else for some other purpose. Hence, information may be obtained from a published or unpublished form, which may be official or unofficial. For example, census data being used to analyze the impact of education on career choice and earning. What are the advantages of using primary data? The investigator collects data specific to the problem under study. There is no doubt about the quality of data collected. If required, it may be possible to obtain additional data during the study period. What are the disadvantages of using primary data? The investigator has to contend with all the hassles of data collection, deciding why, what, how, when to collect, getting the data collected personally or through others, getting funding and dealing with funding agencies, ethical considerations like consent, permission, etc. And what are the other disadvantages of using primary data? Ensuring the data collected is of high standard, all desired data is obtained accurately and in the format it is required in. There is no fake or cooked up data. Unnecessary, useless data has not been included. Cost of obtaining the data is often the major expenses in studies. What are the advantages of using secondary data? The data are already there, no hassles of data collection. It is less expensive, less time consuming. The investigator is not personally responsible for the quality of data. What are the disadvantages of using secondary data? The investigator cannot decide what is collected if specific data about something is required. For instance, one can only hope that the data is of good quality. Obtaining additional data or even clarification about something is not possible most often. Then coming to the sources of population data. The data are obtained mainly through population census. Then second one is vital statistics. Under vital statistics we have vital registration system and sample registration system SRS. The third one is medical certification of cause of death MCCD. Then fourth one is national sample surveys NSS. Fifth one is demographic sample surveys. Under demographic sample surveys, we have National Health and Family Survey NFHS 4 rounds, District Level Health Survey DLHS 4 rounds, Reproductive and Child Health Surveys RCH Baseline Survey. Then Family Welfare Service Statistics. Then last but not least, international and national publications. Coming to population census, it is the most important source of data. The purpose is to produce data on various aspects of population, demographic, economic, social data pertaining to all persons in a country or in a well-defined part of a country at a specified time. So, population census has some special features. Now, the number one is individual enumeration. Each individual is separately but only once enumerated. Some important characteristics of each person are separately recorded, like age, sex, marital status, education, occupation, etc. The third important feature is universality within a defined territory. National census shall cover the country's entire territory and all its people residing or present at the time of survey. What are the methods of collection? There are two important methods of collection, D0 and de facto. D0 means collects information of all persons according to their usual place of residence. De facto method provides the details of persons according to their location at the time of enumeration. Simultaneity. is another special feature of the census. Census is taken as on a given day. The official time is the midnight of the census day. Then defined periodicity. The census should be taken at regular intervals, that is every 10 years. Comparable information is made available in a fixed sequence. A series of census makes it possible to know the past, accurately describe the present, and estimate the future. Census provides information in a series. A series gives general population tables, B series gives general economic tables, C tells about social and cultural tables, D about migration tables, F is confined to fertility tables, H tables on houses and household amenities. What are the uses of census? It provides us with an information on trends in population growth, changes in age and sex structure of the population, the course of fertility, mortality, migration, and urbanization. Census provides us information on nation's occupational, industrial composition, in its level of literacy and educational attainments, in its level of living and cultural characteristics. What are the other uses of census? It's useful in providing a base for drawing up samples for various kinds of surveys. Birth and death rates can be computed. Census data are useful for constructing life tables. Census provides data on social, economic, demographic aspects of population for national, state, district, and Gram Panchayat up to village level. Then comes to the second important source of data, vital registration. In India, the system of vital registration was introduced by the British in the later part of the 19th century. In 1886, the Government of India introduced the Births, Deaths and Marriage Registration Act, a voluntary registration system which served little purpose. By 1903, about 80% of the census population of India was covered by the registration system, which placed more emphasis on obtaining information on deaths and cause of death rather than on all vital events. In 1960, the task for collection of statistics was vested with Registrar General, who was also the Census Commissioner of India. The registration of births, deaths of 1969 now extends to the whole of India. It makes the registration of births, deaths and stillbirths compulsory, and the failure to do so is punishable offense in law. Then comes to Sample Registration System, SRS. The Sample Registration System in India is a dual record system with the main objective of providing reliable estimates of birth and death rates and other fertility and mortality indicators at the national and subnational level. The SRS was initiated on a pilot basis in a few selected states in 1964-65 and soon was expanded to cover almost the entire country by 71. Under dual record system approach, data on vital events and their attendant characteristics are collected through a continuous observation process and series of retrospective surveys. The continuous enumeration of births and deaths is done by an enumerator, preferably a local teacher, and an independent 6-monthly survey is conducted by a full-time supervisor. The data obtained through these two methods are matched and discrepancies between the enumerator's records and the supervisor's results are verified in the field to get an unduplicated count of vital events. The sample unit in rural areas is a village or a segment of it if the village population is 2000 or more. In urban areas, the sampling unit is a census enumeration block with population ranging from 750 to 1000. The SRS sample is replaced every 10 years based on the latest census frame. At present, SRS is operational in 7,597 sample units for 4,433 rural and 3,164 urban, spread across all states and union territories, and covers about 1.4 million households and 7.01 million population. In recent years, the SRS became the important source of demographic knowledge. Since the SRS-based estimates of vital rates are found to be higher than those derived from other sources, they are considered to be more reliable. But the limitation is it gives only the data back 2 years back data. Medical certification of cause of death. MCCD. MCCD scheme was first introduced by Government of Maharashtra in Pune in 1951. Later it was extended to other cities of the state and to all urban areas by 1970. MCCD scheme was made applicable through the country and exceeded legal sanction under RBD Act. But it has some limitations. This scheme is not functional in all the states and union territories. It covered in 28 states and a union territory. Only 17% of the total registered deaths in rural areas and 47% of deaths registered in urban areas were medically certified. National Sample Surveys. The National Sample Survey (NSS) is an ongoing series of sample surveys primarily intended to obtain data on various socio-economic characteristics on a comprehensive basis for the whole country through its various rounds by using the technique of sample survey. Demographic data have been obtained in certain rounds of the survey. The first round of NSS was conducted in 1950. Prior to the establishment of SRS by the Registrar General, the only all India estimates of birth and death rates were obtained from NSS data. In March 1970, the NSS was reorganized and all aspects of its work were brought under a single government organization, namely the National Sample Survey Organization, under the overall direction of a governing council to impart objectivity and autonomy in the matter of collection, processing and publication of the NSS data. Subjects covered in various national sample survey rounds. In round number 23, period of survey is July 68 to June 69. Sample covered was 8,400 rural and 4,632 urban. Subjects covered are population, births and deaths, housing condition, number of Pakka houses, land utilization, yield survey, small-scale manufacturing, household and non-household, integrated household schedules, opinion on production of cereal crops. The other rounds, like round number 39, period of survey January 84 to June, sample covered 43,065 rural and 1,797 urban, total 5,262. Subjects covered population, births and deaths. In round number 52, period of survey July 95 to June 96, sample covered 12,654 with 7,663 rural and 4,991 urban. Subjects covered on healthcare, participation in education, household consumer expenditure and employment and unemployment. Then comes the demographic sample surveys. A large scale and benchmark demographic sample surveys have been carried out from time to time by different agencies in different parts of India, covering different segments of the population. The demographic sample surveys conducted from time to time are helpful to examine the linkages between fertility and its proximate variables, to identify and assess the importance of socio-economic and cultural variables affecting the fertility and mortality, to assess the factors and prospects in the composition of the population in various subgroups, and also to gain an understanding of the determinants of fertility level in a population. National Family Health Survey (NFHS). It is a household survey carried out in 24 states and Delhi. This was conducted under the stewardship of Ministry of Health and Family Welfare. IFAS is the nodal agency. NFHS 1 was conducted in 92-93, NFHS 2 in 98-99, NFHS 3 in 2005-6, and NFHS 4 in 2015 and 16. First NFHS 1 and NFHS 2 were conducted in every 5 years, whereas NFHS 3 and 4 were conducted once in 10 years. This NFHS provides estimates of important fertility and health indicators by background characteristics at the national level and state level, measure trends in family welfare and health indicators over time at national and state levels. The data collected in NFHS are also comparable with those of the demographic and health surveys conducted in many other countries. NFHS 3 provides information on several new and emerging issues like adolescent reproductive health, main involvement in family welfare, family life education, safe injections, perinatal mortality. HIV prevalence among adult women and men at national level and for 5 high prevalence states like Andhra Pradesh, Karnataka, Maharashtra, Manipur and Tamil Nadu. NFHS4 for the first time provides district level estimates for many important indicators. The contents of previous rounds of NFHS are generally retained and the additional components are added from one round to another. In this round, information on malaria prevention, migration in the context of HIV, abortion, violence during pregnancy, etc. have been added. The scope of clinical anthropometric and biochemical testing CAB or biomarker component has been expanded to include measurement of blood pressure and blood glucose levels. The other survey is District Level Household Survey DLHS. Ministry of Health and Family Welfare conducted DLHS in 1997 to assess the utilization of services provided by Government of Healthcare facilities for people's perceptions about quality of services, and International Institute for Population Sciences is the nodal agency. DLHS 1 was conducted in 1998-99 in 504 districts. DLHS 2 was conducted in 2002 and 4 in 593 districts. DLHS 3 was conducted in 2004 and 2007 and 8 in 611 districts, whereas DLHS 4 was conducted in 2012 and 13 in 366 districts. From DLHS 1 to 2, 2 to 3, they have expanded the districts, whereas in DLHS 4, they have concentrated on the quality of the information collected and they have collected in a limited number of districts, that is 366 districts. In district level household survey, the main objectives are to estimate service coverage of ANC and immunization, extent of safe delivery, contraceptive prevalence, unmet need for family planning, awareness about RTI, STI and HIV/AIDS, utilization of government health facilities and users' satisfaction. In RCH baseline survey, under RCH2, the Government of Andhra Pradesh conducted a district level household survey. Indian Institute of Health and Family Welfare was the nodal agency. 11 other research organizations were involved. The objectives are to provide district level data on key maternal and child health indicators, to provide an idea of regional imbalances in the current status of RCH indicators, and to plan for district level interventions for allocation of additional resources for the laggard districts. Then comes the another source of population data, family welfare service statistics. The data on contraceptive use are available from service statistics provided by the Family Welfare Program. Such data are systematically collected, compiled and published by the Ministry of Health and Family Welfare, Government of India. The Family Welfare Service statistics pertaining to India and its states and union territories are published in the yearbook called Family Welfare Program in India. This Family Welfare Program in India, the yearbook, this provides information on characteristics of acceptance of vasectomy, tubectomy and IUD, number of births averted over the years and the percentage of eligible couples effectively protected, data relating to the program input variables. This Family Welfare Program, the yearbook, this publication consists of 4 sections: details pertaining to population and vital statistics, Family Welfare Program statistics, impact of Family Welfare Program, outlay expenditure on family welfare. Health Facility Service. The district level facility survey was conducted by Ministry of Health and Family Welfare and initiated the first phase of facility survey in 1998 and 99 in 221 districts. The second phase of facility survey was conducted in 2003 in 370 districts. What are the objectives of this health facility surveys? To assess the availability of healthcare facilities and their utilization in the sub-centers, primary health centers, the community health centers, first referral units, district hospitals, Indian system of medicine and homeopathy hospitals, and dispensaries. The last source of data is international and national publications. There are demographic yearbooks, statistical yearbook, and epidemiological vital records. There are some important websites. If you want to see the census information, you can go to www.censusindia.gov.in, www.censusindia.net. If you want to go for the SRS sample registration system, you can visit the website www.censusindia.gov.in, www.nrhm-mis.nic. For NFHS information, you can go to www.nfhsindia.org, www.mohfw.nic.in. For DLHS information, you can visit the website mohfw.nic.in. For NSS, www.mospi.gov.in, www.mospi.nic.in. For concluding the population data sources, we can highlight the important findings like Indian census has been a goldmine for population data, including vital events, where one can get estimates even below the district level. Up to village level, we can get the information. However, it has the limitation that fertility rates are not reliably improved over time. The mortality rates estimated through indirectly comes out reasonably good using the census data. Despite of efforts to improve the quality of data in different population census, it suffers from major limitations hampering extensive use of census data in micro-level planning and program implementation. Coming to sample surveys. Sample surveys consume less time, resources, gives accurate and reliable estimates. However, SRS estimates are provided 2 years back data. The estimates are reliable and gives up to district level. SRS also publishes the distribution of live births by type of medical attention received by mother at the time of delivery. This is an annual publication with a 2 to 3 year timeline. However, summary indicators are made available with a shorter time lag. And SRS also publishes some specific publications on specific issues like maternal mortality ratio, maternal mortality rates, etc. Household surveys, currently the most common and overall most reliable data source for health inequality monitoring in low and middle income countries. Data are representative for a specific population, often national, have rich data on specific health topic as well as living standards and other complementary variables. Coming to NFHS surveys, the objective of NFHS is to provide national and state estimates of fertility, the practice of family planning, infant and child mortality, maternal and child health, and the utilization of health services provided to mothers and children. The main object of each successive round of NFHS has been provide essential data on health and family welfare and emerging issues in this area. NFHS 4 data will be useful in setting benchmarks and examining the progress in health sector the country has made over time. In future surveys, we can compare the NFHS 4 data. Besides providing evidence for effectiveness of the ongoing programs, the data from NFHS 4 help in identifying need for new programs with area-specific focus. For the first time, NFHS provides district-level estimates. This indicates that in every round, there is an improvement in the quality as well as in the depth of information.